Hey George, so last night I was looking around online at some different treatment options for my carpal tunnel syndrome. Um, and I found a lot of different information, and I don't really know how to sort through any of it, or what's accurate, or what's good evidence. So I was hoping to get your opinion on it. I found
Okay.
something called phonophoresis. Phonophoresis. I'm not sure what that is, and I was wondering if you can give me your opinion on it, and if there's any evidence that suggests the use of that for my carpal tunnel.
Okay. Hey, John, how are you? Good to see you again. Yeah, those are some good questions. I'm glad you're doing a little bit of research on your own. So, phonophoresis is what you found last night, and that is a treatment option that we can use for your carpal tunnel. And as you know, carpal tunnel, is your median nerve right here in your wrist that's inflamed or entrapped in that tunnel, which causes pain, tingling, numbness, weakness in your hand and your wrist. So what phonophoresis does is uses ultrasound. So we take a little bit of, or we use the ultrasound with medication. So it's a topical medication like an anti-inflammatory or corticosteroid, and we use ultrasound to help penetrate that medication transdermally through your skin to target that inflammation site. So it's a good treatment option. However, after researching this condition myself and this treatment option myself, um, yeah, you do find a lot of good evidence, a lot of strong evidence, a lot of bad evidence, a lot of no evidence. Um, so it's one of those treatment options for this particular condition that may not be the gold standard of treatment. However, it is shown in a lot of studies to help reduce pain, to help reduce um, what they call electrophysiological characteristics, like the tingling um, and the nerve problems. So, but the problem with these studies is that um, every study uses different parameters for what, like if they're using superficial or deep ultrasound, what kind of medication they're using, the intensity that they're using it, the time treatment, the length of the treatment, and then it also depends on the patient too. Every patient is different. A lot of patients can have the same condition, but will respond differently to similar treatment options. So, um, to answer your question, phonophoresis would be a good option to try to help reduce some of your pain um, and weakness and tingling in your hand. Um, so it definitely could help, but there's also a chance that it may not help at all. And that's what the studies show is that, it's kind of hit or miss, depending on, all those things I stated earlier, the type of medication and the parameters and especially the patient. So definitely an option that we can try, but no guarantees that it's definitely going to work. So, but do you have any other questions for me?